Hey, and welcome back to It Hurts to Be Pretty podcast. I'm Angel Renee.
And I'm Lexi Wilk, and we're gonna, I don't know why I just got into that.
And we are a happy Wednesday with...
happy Wednesday.
With the very happy Dr. Char-Char.
Dr. Char-Char here.
And the reason why we say Dr. Char-Char, tell him why.
I don't know if we have the stories aligned, but your Instagram name is Dr. Char _Char _.
It's
and you're so adamant on keeping it. No one's ever going to be able to find you.
I kind of like Dr. Char-Char.
It's kind of taken on a mind of its own.
Yeah, I like it.
It's a vibe.
First of all, you are the owner
Of
what's your med spas?
Hilton Aesthetics.
Hilton Aesthetics. And you have been practicing for how long now?
I've been practicing aesthetics for 6 years and been practicing general surgery for 6 years before that. And then I was in med school before that. So it's been a long journey to get here, but I kind of went a different route. And
yeah, we're going to get into that. Let me have your mic go a little closer.
Yeah.
Yeah, you were an athlete turned surgeon, so you played at Clemson, correct?
I forgot you even knew that.
That's a hot combo. An athlete and a surgeon.
Hey, I'll take it.
It explains all the women that you send over to me. They gravitate towards you.
Oh my God, he's a magnet.
So take me back to you're in school. You're in school to be a surgeon.
Yep.
You graduate and you go where?
So whenever I was in surgery, I graduated and went to a fellowship in cosmetic surgery in Indianapolis. And whenever I was in my fellowship in cosmetic surgery, I realized, this is definitely what I want to do. I want to be a cosmetic surgeon. And I actually came to Colorado to be a cosmetic surgeon. I was applying for hospital privileges at the place I was working. And I was about a month wait for the hospital privileges to come through. And the people I was working for was like, are you sure you want to do surgery? Because they said, while you're waiting, could you just maybe inject Botox and filler until the hospital privileges come in? It was the original goal to start up a breast augmentation clinic at the place I was working. And while we were waiting, they were like, you're really good at like injections. They're like, are you sure you want to be a surgeon? I was like, I just went to 12 years of school. Like, yeah, of course I want to be a surgeon.
Yeah.
So then we started like calculating up the times that they're like, well, think about how long it takes you to see a breast consult. And they're like, you have to do a pre-op setting. You have to get a good size going with what they want. It's going to take you at least 30 to 45 minutes to come up with that. And then they started talking about how long it takes you to do the surgery. It takes about 45 minutes to do a breast augmentation. So I was like,
Wait, how long?
About 45 minutes.
It's that quick?
It's sometimes 30 minutes.
Oh, put me
This
under
one
right
was
now.
15.
Slap some gummy bears
This
in
one was
me.
20. This one's about 15. Wait, did you shut off the air again? Sorry, Lex. She was trying to slow cook me to death.
These lights are slow cooking my eyeballs.
Okay, so you break it down to, a breast aug takes you 45 minutes for a consult, 45 minutes for
the surgery.
For the surgery.
You got to like chill around in the post-op area for 30 minutes, make sure you know that they're okay.
Right.
And they can go home. And then they come back in the post-op setting and they see you in the office for about 15 minutes just to talk 4 or 5 times, as every week after and then you have complications and things that can go wrong. So we added up the time that it takes to do the surgery and the time that it takes and the money that you get from the surgery. Because a lot of people don't realize that the surgeon doesn't really get a lot of the money.
Really?
Like, let's say a breast augmentation costs $7,000. Then the surgeon, the actual breast, what can't I think of it? The actual implants cost about $1,000 per boob. Yeah, I shouldn't say boob.
You can say boob.
I can say boob?
Yeah.
Per titty.
Please, be yourself.
And the anesthesia cost is another $2,000.
Right.
The cost of the facility is another $1,500. And then by the end of you get about $2,000. And it was about 2 hours worth of work all together, added up, maybe even 2.5 hours. During that same time, you could see a Botox patient every 15 minutes for 2.5 hours if you're fully booked up. So like money-wise, we were like, well, you actually make the same amount of money. And I was excited for the lifestyle change because like as a surgeon, your lifestyle is very hectic and you're always on call and you're always having to come in and you're always having to answer your phone. And when you're out, you're still working because it's not like.
But don't you feel it's still like that?
Kind of, but not
but not as
nearly as much.
different.
Yeah,
than the
because I
OR.
feel like I'm always on my phone. I'm always like answering messages or DMs or questions.
Yeah, I mean, the questions will never stop, and especially whenever you own your own practice like we do, like it's always going to come, and that's what we signed up for, and I get that. But whenever you're getting the questions from the other way, it's just a different vibe, and I kind of liked the no stress, or not no stress. I won't say our job is no stress, but it's very low stress compared to an OR setting.
I know. I always remind the girls, I'm like, this is not an ER office. Like, it's
Unless
not that,
my phone's
it's
on silent and you're trying to call me, then it's an ER.
Yeah, and then I'm like, where the fuck are you? Why aren't you answering my text messages? We actually have a funny meme that we have on TikTok.
We
with
do.
Me calling me. Why the fuck are you not answering?
Follow on TikTok at Miss Angel Renee. Anyway.
Anyway, so you, for money wise, or was it kind of both? Because this is very intriguing to me, just because I know a lot of plastic surgeons who kill it and make a shit, like on an injector, or actually just as an esthetician. I look at these surgeons who, you know, make 10 grand a day sometimes, which is fine, right? Like if not more, depending on their surgeries, if they're doing mommy makeovers. Again, granted, when the surgeons that you do see don't do surgeries every single day. They're a lot of times doing consults, right?
They don't. They're right. And then they're also injecting, but what you find is that they spend a lot of their time in the OR and they don't really become as good of an injector, or they just delve it out to everyone else.
1,000%. I have to say, for clients who come in, they're like, I go to this guy because he's a doctor, and I'm like, yeah, but he does breast surgery all day. Yeah, exactly. You want someone who's injecting all day long, every day, because they're an expert at that.
They're an expert at, and I can tell you firsthand, whenever I was in my fellowship, I was operating 8 hours a day, and then I'd go to the office and I would watch people inject for an hour a day, and you don't actually get to inject whenever you're a fellow. You just watch. And whenever you think you know what you're doing, but then whenever you start injecting, you're like, wow, I really just know how to operate. This injecting stuff is completely different. Yeah. So it kind of took me about a year after being out of a surgical fellowship and doing, 80 to 100 breast augmentations that year and 40 tummy tucks and all these things before you actually become a good injector or feel comfortable with injecting. Like it took. Did you ever consider in your mind, I don't want to inject, I just want to do surgery? Because I can't, to me, I feel like doing both would be a headache because you can't really master. I feel like you're either one or the other. Yeah. And I've always kind of had like an easygoing personality when it comes to all the things in the OR, and just a different vibe. Like the OR kind of has its own setting. Like it sometimes can be malignant. It sometimes can be very downgrading where they just talk down to you and stuff. And I was always like the little butterfly, like, oh, let's just get it done. Let's hurry up and do this. But whenever you become an injector, you really become where you see the same patients every 3 months over and over again. And you find that if you love patients and you love patient care and you really truly care about your patients, that you love injecting. With the surgery, it's just a different vibe. Yeah. It's not there's not much of a connection. You only do like breasts like once every 15 years, 10 to 15 years. So you hardly see that patient. I'm due for mine. Definitely. These are
You're due for yours? Are you kidding me? I mean,
I love these. They're so cute.
I definitely have some questions about breast augmentations that I think a lot of people are wondering. So I want to get more into injectables later because it's important. But how does someone find a good plastic surgeon in their area? Like, what's a criteria we should look for breasts? Great question. Anything that they want. Great question. I've seen very expensive surgeons that do not that great of jobs. Yeah. They're just very proud of their work and proud and think that they deserve to get paid that much.
They're proud of their ego.
They're proud of their ego.
And their fucking egos.
There's one in Denver that I can think of, and I won't say his name.
Don't say his name.
Of course not. But
we'll say his name.
His ego.
You can whisper his name.
I will. I can't.
It can't fit through the door.
No, it's so bad.
And this is great about Charlie.
Bad.
He has no ego.
I know. And you know what? When you signed up for our course, I knew you had no ego, because for a doctor to sign up for a course, especially with estheticians, right? It's always this like, oh, she's just an esthetician. She doesn't know what she's doing.
But in the esthetician game, I mean, Angel Aesthetics is where it's at.
Aw, thanks you.
Char.
That's why I send
Especially
because I
have so many haters. I needed to hear that.
Okay, stroke our ego, but back to the question.
Back to it. About
how to find a good plastic surgeon, yeah.
So the best way, I think, is to look at their before and afters. People can't fake before and after photos.
Nope.
People can hide their before and afters, kind of hide behind a nice website and not put a lot of before and afters on. But the only true way to know is to look at their before and afters. Whenever you look at their before and afters in their office, they're not as blurred out, and you can actually see their scars. Judge their scars.
That gives me an idea for
Do people actually post pictures where they've edited out scars? Because I didn't know that. I
don't think many clinics could technically do that and get away with it without being like false advertising. So I would imagine that most of the pictures that you see from actual plastic surgeons before and afters were just taken in a room before and after to try to get the same lighting and the same everything. Excuse me.
Yeah, I think also sometimes I just there's always risks with surgery, right? So you sign that waiver and shit can happen even with the best surgeons. I think with finding a good, for me, because I have been open about my surgeries, the before and afters were huge, and also it's word of mouth, right? So it's kind of like in our industry, you can say you're good, you can act like, you can post all the best memes and everything, but if you are not really good and someone can't vouch for that, like, to me, when someone compliments your work, it's like the best. For them to say, like, you should go here, they do the best work, or you should go here, they're the best at this. And so I think every surgeon, for me, has their like specialty. I feel like even though a guy will do all body, there's one, like, there's a boob guy, there's the nose guy, there's the chin guy, because they all they'll do everything, but they specialize, I feel like, are really good at one thing. Like, I feel like Dr. Shaw, and I can say this on here, is really great at nose jobs. He's kind of known for that.
I'll be seeing him too.
Yeah. Like, he's kind of known for doing, and those are hard to do. A lot of people don't like to do those. But
and every time, like, a plastic surgeon gets like they're known as the whatever guy. Like Dr. Shaw, he's the nose guy. Dr. Campanelli, he's the body transforming guy, for mommy makeovers. And like, they all have like a thing that they do really, really well. One way that I see is, I see a lot of patients who have had a lot of plastic surgery that come in for their face to be rejuvenated. And while they're in there, they're curious because they know my history of being a surgeon. And they're like, what do you think about this? What do you think about that? So I actually see a lot of plastic surgeons work in the area. And I kind of have my own opinions about, who's
share
the
some
best.
of them.
Tell me too.
I know, because I want to know, if you've never had plastic surgery, like, what are some specific questions you can go in with to a consultation to kind of not quiz the surgeon, because obviously the client knows nothing, but what's something specific that
you could ask them what they do the most of.
Okay.
That's obviously one of the first things, and every plastic surgeon will have a before and after book sitting right there in their office. And they will only put their best before and afters in that before and after book. They're not going to put their worst. So if you don't like their best and their best in before and afters, that ain't the right person for you.
Yeah.
You should probably go to look at some other avenues. And not all surgeons have a consultation fee. Not all surgeons charge astronomical amounts just to talk to them. And just to get an idea, I think that if you're actually looking for plastic surgery, you should talk to a couple. Don't just talk to one. Get a couple ideas from what they do. And maybe even talk to patients that have been to them before. That's a huge deal. Like, it's hard to find that if you don't know who to ask or whatnot. But you could ask the surgeon to put you in contact with someone or whatever, but talking to someone who's been through the experience with that surgeon is
Okay. But I think girls are a little more open about surgery now, especially around other girls. Like, oh my God, where'd you get your boobs done? Oh my gosh.
It's like asking where you got your shirt from at this point.
Yeah, like I think women are a lot more open about it. It was before it was like hush hush and, you know, definitely like, oh, I woke up like this. And that's why I've been very transparent about my surgeries, because I'm like, I'm 43 years old. I didn't get here by olive oil, you know, like definitely been doing Botox since I was 26 and love it. Love taking care of my skin. And I feel like the more that we're open about it and talk about it, you know, definitely more people can be educated, especially in picking the right surgeon, because I've had a good friend of mine who got botched, in fact, in 2020, and we'll meet her on the podcast.
Oh, I know who it is now.
Yeah. So she went in for the douchey guy that I just talked about.
The nipple, yeah.
And this was in 2020, and after her surgery, I was like, let me see your boobs, you know, because that's how girls are. And so we're FaceTiming, and she shows me her boobs, and I'm like, okay, so one looks like this. So she's like, oh, he said it was the swelling. I'm like,
your nipples are
so then
look in different directions.
Never took ownership for it. Blamed her. I mean, it was just, he was shitty the whole way through. And her nipples
terrible surgeon.
Were literally crooked. And so I said, if 2020 were nipples, those would be it.
And then sometimes whenever you got nipples looking in different directions, sometimes it's just that one of the pockets hasn't dropped down yet. So if the pocket's still up high, then the nipple's gonna be pointing down as soon as the breast implant drops.
But see, she took out her implants.
And I know someone personally who is literally, we're not gonna get into it. My thing with surgery, I am pro whatever the fuck you want to do with yourself. But when it comes to a client's safety, that's an issue for me. And so I think back to search for other people who've had good experiences, search for people who've had bad experiences too. Yeah. Because there is this whole community of women I know just in Denver against a specific surgeon because he is, what's the word? Negligence. I took a shot. I can't
Negligent?
talk. Negligent? Yes.
Oh, well, that's the same douchey.
Yeah,
we're calling him Dr. Douche, by the way.
Dr. Douche.
Dr. Douche. And here's something that happened too. So when you and my mom had met, she is totally jaded by Botox. Her eye droops every time. It's never the result she wants. But when you walked through it with her, you were pointing to areas she had never even been told before. Yep. So I think just having that level of expertise, like you've operated on people and...
Yeah, you figure out the forehead. The forehead's the hardest thing to figure out with Botox and drooping and all that good jazz.
Especially with people with heavy lids.
Especially with people with heavy lids. There are things that you can do to not create the heavy lids. Obviously, the first thing is to do the forehead in like a V pattern instead of straight across. Like maybe just make it a little extra. You know, like more than you normally do.
Everyone's going to their injectors now, like.
And I also inject right in here to kind of lift a little bit.
Right in the lateral orbicularis, the relaxed lateral orbicularis, so the medial kind of compensates.
No one listening knows what the fuck you guys are talking about. I don't.
The orbicularis is a circular muscle that goes around.
Right around
That's what we do for the crow's feet.
I failed anatomy lab once.
Yeah.
I can't do it.
And were you allowed to talk anatomy in here?
We can talk anything.
Anything we want?
Yeah.
So like, to me.
Other things that have come out in like recent plastic surgery journals are like when to inject deep and when to inject superficial. What I've learned is when you inject deep, it lasts longer, but you get more deep. You get more droop. If you are ever going to inject more superficial, where you just basically barely bury the bevel.
Yeah.
It's hard to
barely
say.
Barely bury,
yeah. And you just put the bevel right beneath the skin and inject kind of superficially. The Botox does have more of a chance to spread because it's not really being held down by the fascia beneath the fascia, but it also doesn't give you as much droop. So in some of my clients that have heavy eyelids on these lower two lateral shots,
you stay superficial.
I stay superficial.
So lesson, if you've had Botox and every time you're drooping, it's time to see a new injector, really.
Yeah, either that or yes.
Because really, what are they going to do? Walk in and say, well, I heard on a podcast that you shouldn't be injecting deep.
Yeah, and I feel like every injector is so different. And every time you're around an injector, you either look at them and you're like, I definitely would never do that. Or you're like, oh my God, I could actually start doing that. You know? So I think you learn from everybody. what to do or what not to do as well. And just, again, like he was saying, know their work, know their before and afters, and also client experiences. You know, people talk now. My Botox lady is amazing. My Botox person is horrible. Blah, blah, blah.
They all talk.
They all talk. And so everyone, or you have the ones, and you'll know this, who just want the deal.
Yep.
They want the
Groupon special.
They want the Groupon special, and no offense to Groupon. It's just, I want it and I want it now. I got told off one time when I posted that. They went in on me. How dare me put down Groupon? Who do I think I am? Blah, blah, blah.
They missed the point.
Yeah, the point was when you shop for cheap, right?
I say you can either get one of three things. You can get something cheap, you can get something good, or you can get something fast. And you got three things that I said, but you can only get two. You can't get all three. But make it right every time so that someone knows they're going to get what they wanted to get. And then the biggest thing is that if you don't do it right and you accidentally mess up, take some blame and pull the thumb a little bit. Don't always point the finger and say, oh, did you walk around doing this all day, raising your eyebrows and all that? I don't even know if that does anything, by the way.
I never make
I don't think.
Yeah, let's settle. Does moving your face, because one of our old employees used to say, I don't move after I get Botox for weeks because it's going to dissipate it. So when
I asked my fellowship director when I was in fellowship, I said, why do we ask our patients to do this? Does it really make a difference in setting
like
the
pre-injectables?
Botox? No, post-injectable.
Post
Botox.
To move.
So they say it's supposed to work it into the muscle better. He goes, it gives us, it's like, it makes them think that they're helping.
Fuck that.
And he was like, it makes them think they're helping throughout
I'm always like, don't do any of that shit. Just don't lay back for 4 hours.
And then if something goes wrong, like they get a wonky eyebrow, you can be like, did you move all day? And you can blame it on them.
Effed up.
Yeah.
That is, honestly.
Integrity is everything in this industry.
Yeah.
I'm telling you.
I'm a big believer in owning up to your shit. Like, how can we make this better? You know, sometimes, and I've said this before, like, not all my Mile High makeovers have been amazing, you know, and it just is what it is. Some people have stubborn skin, or it doesn't turn out exactly how you wanted it, and it frustrates me because I want to help them just as much.
You hate it just as much as they hate it.
Oh my God, there's times I can't even sleep at night because I wish I could make their skin better. So I think owning up, like, I'm sorry, and I will even say, do you want your money back?
Yeah.
Because I don't need that.
I'll be the first one to give someone his money back if I don't feel like I did a good job.
If I feel like, you know what, I would, in that situation, if I felt like nothing really changed, I would feel happy if someone, happier, right?
If they gave you
your money
back.
So I put myself in their situation, like, please, that's the least I could do. You know, it sucks. There's no cure for melasma, that sort of thing. So, you know, it's hard because you want to please them, but you also want to run a business, but integrity is everything. And I could tell by the way that you treat your clients that you really do have integrity and that you are doing this because you truly love aesthetics, which is so cool.
I love it so much. It's kind of like that Conor McGregor when he's like, I lost my mind into this. I've lost my mind into aesthetics. I feel like I go to a conference every 2 weeks, or at least
that's amazing.
Every 2 to every 3 weeks, somewhere, flying somewhere, learning the best stuff. I want to be the best at it.
Yeah.
And I feel like anyone that does this job should do that.
Yeah.
Like they're doing themselves and their patients a disservice if they're not going to conferences, if they're not trying to continue to learn. Like, have you heard of Jelly Roll?
Yeah.
Yeah.
Wait, the
country?
Oh.
Angel thought it was Are you thinking of Young Gravy?
I thought it was a country singer.
Oh yeah, you know Jelly Roll.
Yeah.
He has his guitar all
Jelly
good.
Roll.
I think he's playing at Seven Peaks this weekend.
Oh my God, I can't believe I just said that. I went to country. That's the only Jelly Roll I know, but the Jelly Roll under that, yes. Okay, so the Jelly Roll, you guys didn't believe that I know a country singer named Jelly Roll. And I just proved to both of you that there is a country singer named Jelly Roll.
I mean, I'm from South Carolina. I listen to
country. And you're going to love him. Watch. Now
Never
you're going to listen.
Of him, but now I like
Now you're going to love his music. Okay. No, you were actually talking about the Jelly Roll underneath the eye. Yes, I do know what that is.
Yes. So, like, I'd never been doing Jelly Rolls before 4 months ago.
Really?
And then went to a conference, found out how to do the Jelly Roll maybe 5 months ago.
Describe what it is, though.
So
what does it look like?
Smile. The Jelly Roll is right here, where your orbicularis at the bottom, because it's a circular muscle. It goes all the way around. Starts to bunch beneath the eye. And every time we do the crow's feet, every time we do the glabello, we get compensation somewhere. The body always compensates somewhere in the body. And whenever you do here and freeze the orbicularis here, and then you freeze it all the way at the top,
so
and then the whole side, then the rest of the orbicularis that actually moves is actually down here on this part. So by putting one unit mid-pupillary line right beneath the eyelid.
But you
I don't dilute it. I just do one unit per side. And one thing I learned is if you just do it where you try to push the needle here and hope you don't hit the eyeball, that's very dangerous. So put a dot with your derma marker.
Yeah.
And then pull it down. And then you can do as much as you want. You're not going to hit the eye.
So if you're at home and you're smiling and underneath your eye, you're seeing, I guess, like part of your eyeball, right? It's like that.
It's like
puffy. It's a puffy area.
It's a little roll.
It's a little jelly roll.
Yeah,
Google if you're wondering do I have a jelly roll or not.
Yep.
Google it, and that is something correctable with injectables. It doesn't need to be surgically removed.
And not a lot of clinics are doing it because they're very scared to go that close to the eye.
Yeah.
But if they just pull it down and go from the side and just stay superficial, you'll be fine.
So back to the searching.
But
before and after.
What does that help with? Soften that muscle when you're smiling.
Softens that muscle when you smile. It makes it where I've seen some miraculous results with it, where even like eye bags that had big bags, whenever they smiled and they had a huge bag, they did the jelly roll and they smiled and it's no bag.
What's your opinion on tear trough filler?
I love tear trough filler. I have a love-hate relationship with tear trough filler. It's probably the best thing that I do at my clinic. And not a lot of people like to do tear trough filler because of all the risk being that close around the eye. I feel like as long as you use a cannula, you're pretty safe. The thing with the tear trough is that you get FARE. And
what does that mean?
FARE, P-H-A-R-E-E. It's post-hyaluronic acid, recurrent erythema, and something else. Basically swelling under the eye. And FARE is like kind of coming out in all the journals right now, and how to treat FARE and what can you do. And people are even using things like Morpheus, like microneedling with radio frequency to help dissolve the filler that's a little too superficial and causing a Tyndall effect, to maybe not show that bluish hue anymore. Or when they smile, they get a bulge, you know, it looks like a caterpillar or worm. And I'll be honest, I can't get 100% correction in every patient. And not every under eye is meant to be filled. Sometimes they need blepharoplasties.
That's what I always say.
How do you know when to consult with a surgeon first, or as a patient?
As a patient, you don't know till you talk to an injector that's been doing it all the time every day that you actually trust. So see an injector before a surgeon. I will say this. I've seen so many under eye complications that come into me from other clinics that I have to dissolve. They place the filler below the orbital septum, and now their septum's bulging, and they have a bigger bag than they had before.
And that blue hue.
That's too superficial, and it's too much. Less is more in the under eyes.
Would you say that's the number one filler correction that you see people needing?
If you look in the journals, like 50% of under eyes have to be corrected at places that don't do it a lot. Wow. If they don't do it a lot and they do an under eye, they're going to have 50% correction rate. I would say out of all the fillers I do, the under eyes are the ones that I have to correct the most, because sometimes you put a little too much and you just need a baby drop of dissolver. Or sometimes you don't do enough on purpose because you don't want to create the caterpillar when they smile. And then they still have a little bit of a tear trough and they want that fixed. And I love saving syringes. Like in my fridge, I'll save syringes for up to a year, and I keep a little bit to touch them up. You know, like when they need to be touched up, we'll touch them up. And I never like to just say.
Is it next to like the cheese?
Well, yeah, it's right. It's right by.
Are you like? Is this where like the milk and the eggs are? Is this where you save the syringes, Dr. Char?
The syringe is just meant for aesthetics.
I'm just kidding.
It does have some bottles of water in there, so I give my patients.
That's sanitary, hydrated and filled.
Frappuccinos if they want.
Frappuccinos, ew.
It's a bougie clinic. You gotta have bougie stuff for it. It's the Fiji water.
True. Well, I want to talk about Boobs one more time before we get into his secret talent that we just found out about.
Oh, Lord.
Oh, my God. This is the best. This is why I love podcasting.
Yeah, you learn stuff.
Yeah.
I want to know the difference between, it's like the silicone, the saline, the gummy bears, the this, the that.
Oh.
Everyone is getting not everyone. there is a movement where people are getting their implants removed because of
Breast
silicone toxicity, or I don't know the scientific term. So get into that. I just choked on my spit. I got
people
so
that have
heated.
Autoimmune disorders.
Yes.
So there's a debate going on whether or not gummy bears cause more breast cancer. And gummy bears.
Sorry, I'm jumping the gun.
What's the
I'm
difference?
just so excited.
So silicone is made out of silicone. That is a breast implant. It looks like a circle. It looks like a red blood cell, kind of.
Oh, I felt these many because you're the silicone.
You got silicone.
Yeah,
and
we love the feel of it.
Not all silicones are the same. Some are low profile. Some are medium profile. Some are high profile.
It's like the stiffness of it?
No, it's
where they're placed.
Where they're placed. Like a high profile is going to give you more upper pole fullness and project more this way. It's going to have more anterior projection.
I'm down for that.
Whereas a regular, breast implant is going to look more regular. And then a low profile means they don't need a lot of anterior projection. So it's like a flat implant where they just needed a little bit of love. Okay. No one ever does low profile. Let's be real. Women want breasts.
Especially as we get older, they drop already.
Unless like post-mastectomy.
They're already
and I will say this, like the movement back in the 80s was for everyone to get the saline and to get the huge
round balls.
So that's saline.
And
saline is
round ball.
The saline was the liquid. That it could burst.
It could burst. The cool thing about when it bursts is that you know that your implant has burst and it's leaking into your body because you have a deflated tire on one side. Whereas a silicone, if it was to burst, it looks still like a brute. Like you might see some other signs that come like capsular contraction. Maybe even later you get erythema of the skin, other things that turn red. Or you get fevers or something like that, or you just have pain and you just know that it's busted, but you don't actually know it's busted unless you do actual imaging, like a CT scan. Whereas with the saline, when it busts, you know it busts.
You can get it quick and correct.
I remember I put a saline into a 65-year-old lady, and then she put the Christmas tree in her attic 2 weeks after my surgery.
Oh.
And then it came down, the Christmas tree came down the ladder and just busted it, and she knew instantly because one was a deflated. So like,
first of all, okay. Anyway, go ahead.
Getting back to the
why?
I even forgot we got on our tangent.
So with the silicone, are they becoming more technologically advanced? Like are they less prone to leakage and causing all these issues?
About 7 or 8 years ago, they started delving with making the implant actually sticky on the back so that it stuck to the chest wall. But then it's called a textured implant. Yeah. And it just means it's rough. It's like sandpaper versus like smooth like butter or like this table.
You felt them in Nashville.
Yes, I tried them on.
They're rough.
Yeah.
And they're supposed to stay in place better. They're trying to get it not to fall and not to get it to
that's the issue when it starts to leak. It falls and...
Not necessarily. No.
It can move.
It can move.
Okay.
It can move, yes. Whenever it leaks, usually it's pain. Usually it's pain or it just looks a little different. You're like, something's off. I can't tell exactly, but something's not how it was. And a lot of times people go years without knowing that they had a leaky silicone implant. They show
autoimmune.
Well, what they do is their body encapsulates it. And they leaked, and then their body encapsulated it, and then the breast becomes a little harder, it becomes a little different shaped, it becomes a little more round. It's not as teardrop looking. Capsular contraction could happen from anything. You don't know what causes capsular contraction. It could be from a biofilm from the skin. It could be from anything. That's why they give you Hibiclens the night before to wash the breast beforehand to try and get all that bacteria off the skin. They say a lot of the, because some surgeons will do a periareolar incision where they go right below the nipple. Some people will do a inframammary incision where they go down beneath. And then some will do a transaxillary. And it just depends. Like the mammary has been shown to be safer, and some people think it doesn't have as much of a biofilm, so they have a less...
Intramammary is... Infra.
Underneath.
Right
underneath.
Here. Okay, so that's your preferred method of incision, you would say?
Yeah,
that's the more common one.
It's the more common one. The reason why I don't like the peri or reeler is because...
Which is where for us
around the nipple.
people?
Around the nipple.
Okay.
So you make a semicircle beneath the nipple, and you basically retract the nipple up and put the entire implant through that tiny little nipple hole. So it can distort the nipple sometimes. Yeah. I personally trained and learned how to do the peri or reeler one the most whenever I was in my fellowship training. Although most people are doing it inframammary. I kind of like the fact that there was no scar on the breast. You know, like sometimes you couldn't even tell they had a breast augmentation because you could make the nipple look really good. But sometimes the nipple became a little janky, where either you stretched it too much when you're trying to put in the implant.
Or you put them on crooked.
In that case,
we're dealing with an areolarplasty where you have to raise the nipple up.
So the what do you think is trending right now? Do you think
I think smaller breasts are trending right now?
Yeah, like a lot of people are taking out their breasts. Yep. A lot of people are apparently not wanting ass. I don't know how. I think having
Kim
an
Kardashian's
ass
skinny now, like skinnier,
so
not as curvy.
Who made them like
she's always
trendsetter? That's so dumb.
The Kardashians, they are setting the body type trend. It's crazy.
I think it's fine, but either way, it's like if you have an ass, you have an ass, and I think it's good to have. You know, for me, being too skinny or like I just feel I think about my daughter, right, and I would hate for her to feel like she always has to be skinny or always have to be the certain way. Is there ever a time where you tell a person, especially with injections, no?
Oh, all the
because
time.
Of the addiction.
I tell at least one person a week, no. Like, they come to me with huge lips already. It's usually lips that I'm telling people no about. Because they get this body dysmorphia, whatever you want to call it, where they get used to the lips huge, and then it's like they're walking around like a filter, but statically they might look okay, but dynamically they're not. So like...
She thinks my lips are massive.
No, first of all, she had no lips when I met her.
Literally.
And the filler does like eat up in her body. I don't know where it goes.
It's lasted a while this time.
Yeah, and I think her lips are beautiful.
I think your lips are perfect.
Yeah, so, but...
Okay, Mom and Dad. Sounds like when I go home for Thanksgiving. You're perfect
lips.
the way you are.
We love your boobs. We love your lips.
I'm like, all right, scheduled the breast implant and yeah.
Okay, so for someone like me I've had my breast implants for 15 years. I'm going to have them redone just because it's been 15 years.
Yeah.
Do you think that same kind of style since my body already knows that? Or I was thinking of going more like of the droopy because I like that look.
You like the droopy look?
I do.
What's the terminology for the droopy? Is it the gummy bear or am I making that up? I keep saying gummy bear.
I thought it was gummy bear. Or the
That's
teardrop.
Teardrop look.
Teardrop.
And is that silicone or saline?
Silicone.
Okay.
So like
it's a teardrop where it's...
Teardrop, yeah.
The thing that I heard, not to interrupt, is that it can move and then it's... like these are round, so if they move... They're always going to be round.
Always round.
But if the other one moves,
then it turns to a different way. I have heard that a lot of people, I don't know because I'm doing injections now for the face, but from what I've heard, that a lot of people are moving away from the gummy bear because of some of the when it moves, or because they're definitely not doing textured anymore. And so a lot of the gummy bears, when they first came out, were textured. And now they are trying not to do texture because of the increased risk of breast cancer from textured implants. That's been proven.
Like the actual texture on the outside,
on the outside of the implant.
Carcinogenic, or?
It's not that it's carcinogenic. It's that, well, technically, it's not that it's carcinogenic, but it does create more of a inflammatory response. And anytime that happens, I mean, you can get more of, bad things that you don't want.
Wow.
And the saline is what it is. People are going to do saline, or they're going to do, but saline can't be a gummy bear, or it can't be in a teardrop shape. It's got to be in a circle that looks like a lifesaver or a red blood cell or whatever you want to call it, bilobe.
A donut.
And because the water is just going to go where it's going to go. Saline is basically water in a Ziploc bag. That's a circle. Whereas I mean, silicone, that's what I have my patients squeeze whenever they're doing their, Botox and filler. They're still in a circle. And if you take it and throw it up in the air and make it into where it spins, it's still going to look just like a circle. It's the other ones that are different and I feel like most people, for instance, in my fellowship, I did probably, we'll say, 80 to 100 breast augmentations. And I only did 6 or 7 out of those were saline, and none were of the teardrop shape. Everyone else was just silicone, regular circle. It's all about how you place it, where you place it, how you look at the body, how your aesthetic eye sees a body. I kind of noticed that the older surgeons tend to still do what they think is attractive in women. And they're like in the 80s still, and they're like, oh, I want the big candy cantaloupe look. Whereas like the new guys that are coming out are like, they understand that women love CrossFit. Women love, some of the other ones? Core 44, whatever.
Core Power?
I don't know. Core Power, you name them.
Yeah,
they love working out. And like
everywhere.
fit is in.
Yeah.
And tiny is kind of coming back, and like smaller is coming better.
That looks small, but not a AA. Can't fit in a bra.
First of all, I love your boobs.
I know. I love your boobs. Let's trade.
Okay, so what's one more question you had?
So one more thing, though, while we're still on that topic, is if you go bigger, eventually, as you age, gravity is going to take over.
Yeah, that's what one
is that why they have you get new implants every so many years? It kind of drooping, or is it the safety of it?
It's not necessarily the safety of it, because, I mean, yes, it is, and no, it's not. It's a double-edged sword. I've seen implants that have been in for 20 years, and they look just like they put them in yesterday.
Yeah,
I know. That's why I'm like, should I just leave mine alone? Sometimes
the thing whenever you start to like get older and you start to age and your breasts start to change is
Thanks,
that you
Dr. Char
want them lifted. Well, like you've had kids, and if they breastfed, then they're gonna suck the life out of a breast. That's what kids do. They turn nice voluptuous boobs into flat pancakes.
Even if they're implants?
Would you suggest a woman waiting to
always
till after
they've had kids?
I'm getting it before my wedding.
Breastfed.
Whenever that is, I'm not engaged. So.
I got mine after I breastfed because they just deflate, and then you're gonna need to
redo it anyway. So like you're gonna be so disappointed with them after you breastfeed. I'm not saying like it's not a hard no. Like you can have implants.
Women do it all the time.
Breastfeed and they're gonna look fine.
Yeah.
But for optimal results, yes. Once you've breastfed, you can make it perfect for a lot longer than if you did it before you breastfed, and then you breastfed, and then they deflated and they're not the same shape, and then they're like wanting to be redone, but you're like, oh, I just did this 3 years ago.
All I hear is I'm making my appointment before kids. So.
Okay,
no,
I don't care what you say, Dr.
And you are so knowledgeable, and everyone should definitely see him at Hilton Aesthetics.
So
and
sweet.
We found out something very amazing about him right now when we took a little break.
He's going to sing us a song.
Oh, he's not singing us a song.
He's going to sing us a song because he was on The Voice. And please tell us.
Auditioned for The Voice.
Okay, so he could be terrible.
He could be terrible.
Oh my God, if you're terrible, I'd love that.
But he did make it at least a round or two on
Okay, you have to just sing something. Make up a song about Angel and I.
Oh yeah, make up a song about
anything. That's the closing.
No. Just sing what you sang for your audition. Just a little part.
Oh my God, I'm gonna kill y'all.
Here, take a little bit more.
Y'all put me out. Yeah, take some liquid
Charlie.
courage.
3.
First of all,
2.
Dr. Char. He has
Dr. Char.
I don't like when people call doctors by their first name. My pet peeve.
Okay.
Yeah,
I don't ever mind it.
Just because I feel like
Dr. Char.
I like Dr. Char.
Sing us your song.
Y'all are ridiculous.
Ready?
I don't even remember what I said.
Okay, yes,
no, but he really
stop talking.
Auditioned for
The
Voice.
Distracting. He's gonna sing. Okay. He's thinking of it.
All right. So when I was auditioning, I think I sang.
In Denver?
It was in Detroit.
What year?
2015, season 10. And there's a lot of people don't realize what happens on The Voice, and there's like 25,000 people that audition for The Voice in 4 cities across America for just those live shows that you see on TV. Because remember how American Idol, they like let you see all the sucky people?
Were you on TV?
No, I was not on TV. But they have you do like where 10 people stand on a star and they have you sing for 30 seconds. And there's just a producer. And there's one producer per room. And you get 30 seconds to sing. And at the end of that, she says, step forward or stay on your star.
Yeah.
And if you're still standing on your star, you made it to the next day. And the first day there was 25,000 people there. And then the second day they only kept 250.
Oh my God.
So they really only like
okay, give us your 30 seconds because we have to
past the first round.
Give us your you don't even have to give us 30. Give us 15.
Just a
I'm
little.
from South Carolina.
All right, stop.
I love
Stop
it.
distracting. Let's do it. Anything.
I like sleeping in on Saturdays, and I love college football games. I love not acting my age and good barbecue. Do you know this song?
No. Angel loves it though.
I
do. Okay, you're the only country music I like.
Okay. No, I loved it.
That was a horrible version of it.
No, love it. I would have made you stay on your star, but thank you so much for joining us on It Hurts to Be Pretty. We want to have you back again.
I want to come back.
I think we have so much to talk about, but we just scratched the surface. But thank you so much for taking time out of your busy day in your scrubs after work. We love you.
All right, hooray.
We'll link where to find him and how to book an appointment in the show notes.
I appreciate you guys. And best skincare place by far I've ever met right here. I will always send all my patients to her. She is phenomenal.
Thank you.
Oh,
thank you guys so much for everything that you do.
Are you going to cry right now?
Yeah, I'm going to cry.
Bye, guys.
Bye.